Hello and welcome to the show. If you've been reading the local paper or even stopping into our convenience stores in town, you're probably aware that there's a bone marrow drive set for July 25th. The ostensible recipient of the bone marrow would be Jessie Williams, a 3-year-old here in town, but the truth is that that bone marrow that you donate may go to anybody across the country. The organizer of that bone marrow drive and Jessie's dad is here with us today in the studio. Hugh Williams, welcome to the show.
Thank you, Maya.
Hugh, what I'd like to do in this part of the show is get a feel for Jessie, her background, and how this all started. When did you first know that Jessie was sick?
We first noticed when she was 3 months old, when she developed a rash on her skin on most of her body. It was a horrible rash. She was crawling out of her skin. It itched so bad that we finally were referred to a dermatologist at UC San Francisco. They did some cultures from her skin and put us in a small room with a social worker. That social worker then asked us if we knew where we were. And I had a feeling, after seeing all the small children with their caps on, that we were in the cancer clinic at UC San Francisco. And at that point, she described what they believed at the time was Jessie's illness as histiocytosis, which means histiocytes in her cells, which caused her skin to boil. At that time, she started on a therapy with steroids and chemotherapy, and the saga began at that point.
Now, this is something I've been privy to, being a friend of the family. I've seen a bit of what Jessie's gone through, and it's hard to put into words what that little kid's been through, but you can tell us a little more about it. That was her original diagnosis. Was that the diagnosis that they stuck with?
Well, no, it's changed over the months. She's so complex. With her chemotherapy, she got an immediate result, which was great. But then shortly thereafter, the rash came back, and they started doing some further testing and realized that they were on just the tip of the iceberg. We went to UCLA for some further studies. As the donor. That put her in hospital for her first Christmas, her first birthday, my birthday, and she's been in and out of the hospital since then. The bone marrow transplant engrafted or took, but the conditioning for the transplant, the chemotherapy, the radiation therapy, all the various medicines that she was on, was maybe not necessarily effective in the conditioning prior to the transplant. So she was left with some of her mother's cells, which caused a syndrome called Evans syndrome, which destroys the platelets in her blood. With a low platelet count, the problem with that is bruising. You become like a hemophiliac, you bleed. And her platelet count is so incredibly low that the worry is that she could spontaneously bleed in her brain, in her stomach, anywhere. So she's been giving transfusions. She's had 15 different transfusions of platelets and or whole blood. And she's had so many, in fact, that they can't give her anymore. She's sensitized to the platelets, and they no longer do any good. So when her platelet count gets down that low, we're actually at a point now where our backs are to the wall.
Tell me a little bit about what Jessie's daily routine is like, Hugh. Most 3-year-olds get up, take them to daycare, and you're off to work. That's not the case with Jess.
Not at all. Many of the drugs which she's on are immunosuppressants, which means her white blood cell count is considerably lower. Her immune system is fragile. She can't go to normal daycare. She can't, well, not supposed to go out in public. She can't be around sick people. And of course, you never really know if someone is sick until after it's too late. Right. So she gets up in the morning, and it varies at different times, of course, but does about 10 different medicines orally. Also, some of them are intravenously. She has a tube surgically implanted in her chest, which we do blood draws on Monday, Wednesday, and Friday, and have lab results. I really wish I'd studied my chemistry greater when I was in school. But
You're learning now.
unfortunately, I'm beginning to learn way more than I had ever imagined or ever wanted to. So the daily routine is give her tons of medicine and try to keep her comfortable.
You mentioned that your backs are against the wall in terms of options for Jessie. What are you looking to do now? What is Jessie's next step?
Jury's still out on that. We're dealing with several different variations of drug therapies. 2 weeks ago, we gave her a drug therapy with chemo, with 6 different other agents, and she reacted horribly to them, and we almost lost her. At that point, we've decided as a family to back off on those medicines, and in fact, her counts have rebounded somewhat. The bone marrow transplant may or may not be her destiny. I'm just not sure. The family hasn't committed to that at this point.
Okay.
Without it, she may rebound, or she may not make it. With it, the conditioning for the bone marrow transplant would be incredibly hard on her, and she would have to be hospitalized and watched and monitored and fed. You know, it's going to be a tough road any way we choose.
The options aren't simple.
Hardly.
Hugh, tell me a little bit about this. You started to get involved with the bone marrow drive long before you thought Jessie was going to be a candidate for that.
Yes.
How did you get involved in that, and what are you doing right now in preparation for this drive?
We spent quite a bit of time at hospitals, and when you get into a situation such as that, you meet other families that are in similar situations. The little girl down the hall, her family. One of them that rings a bell is a child was in the hospital. The rest of their family, brothers and sisters, were farmed out to friends and relatives, and it's just destructive to the whole family unit. It was heartbreaking. And with this familiarity, I knew that since we have good insurance, we've been well taken care of, that it was my turn to give something back to all these other families. And so I wanted to do a bone marrow drive. And it was only after I had the ball rolling on that the doctors informed us that indeed it was a possibility for us.
So, I'm sorry, breaking away from Jessie a little bit here. The date for the bone marrow drive is July 25th.
July 25th.
And people can go to the new Tahoe Forest Medical Building. Is that where the drive will be?
The drive is scheduled for the new Tahoe Forest Medical Building on Donner Pass Road from 11 a.m. to 6 p.m. If someone cannot make it that day of the drive, there will be information on the screen later which shows that at Tahoe Forest Hospital, every Tuesday, you can go in for blood testing.
Okay, so you don't have to make it on the 25th. You can come in on an alternate date. And it's important to note that we will be showing the toll-free numbers for information as well as the dates and times for signing up.
That's correct.
Hugh, I know that this has been a really rough time for you and for Denise. And not only my feelings, but the community's heart goes out to you. I certainly wish you the best.
Thank you.
And thanks for joining us. Welcome back to the show. We're talking about the bone marrow drive on July 25th, and joining me here in the studio today are Mario Cabrera and Gwen Richmond. Thank you both for coming.
Thank you for having us.
Mario, tell us a little bit about what your background is and what your involvement is with this drive.
I work from the Sacramento Medical Foundation. I'm the Marrow recruitment specialist, and what I do is when I receive phone calls from parents or individuals that are wanting to do marrow drives, I make the first initial contact, meet with them, and then set up all the information so that we can get rolling on a Marrow drive.
And how long have you been working with the Williams family?
I've been working with the Williams family for a few months
Okay.
and just setting up this drive that we're having in July.
Okay. And Gwen, what is your role in all of this?
Well, the bone marrow registry is something that I have always felt really strongly about, and my husband and I are both registered in the bone marrow program. I'm here today as part of this California Medical Assistants Association, our local Truckee Tahoe chapter, and we've been trying to get a marrow drive organized for quite some time, and so I've offered my help to Hugh in any way that I can to make this a success.
Let's talk about the drive itself specifically. We see blood drives in town pretty frequently. The service clubs put those together. What makes a marrow drive different, and what should somebody expect when they show up on July 25th?
I think the difference with the marrow drive in itself is to compare it to a blood drive. People are coming in and giving a whole unit of blood, where the marrow drive you're only coming in and giving 2 vials of blood so that it can be tested for the bone marrow registry.
And when that blood is received, you become a barcode, and you get back a little card with your barcode, and you're in the computer, so that at any time, anywhere in the country, and even internationally, if someone comes through the computer that matches your specific, the HDL in your blood, then they'll contact you to do more specific tests to see if you can be a marrow donor.
Now, you're giving really no more blood than you would give at the doctor's office for a basic test.
Exactly.
And yet you may be benefiting people across the country, is that right?
And even internationally.
Okay. How does this work for other Truckee residents? I know that we've been talking about Jessie, and she's been, as Hugh calls her, the poster child for this drive. But if Jessie is not the only person to benefit from this, who else in the community might?
Anyone.
Anyone that comes up with any other blood disease.
There are at least 60 disorders that can be treated with a bone marrow donation. Leukemia is one of probably the best known. Aplastic anemia, Fanconi syndrome. There are many, many syndromes and conditions that can be treated with a bone marrow donation.
Okay, and we'll be seeing a video clip a little bit later on that'll kind of get into more of the specifics. What can people expect when they show up on July 25th? You said that they'll have to give 2 vials of blood. Are there any medical risks involved in being tested?
For that day, no, there are none. The procedure is really simple, just having them come in, fill out a consent form. The 2 vials of blood are then drawn from their arms. There are no risks. It's such a small amount of blood that's being taken that they don't have to fast or feel like they need to replenish the fluids.
Will they get cookies afterwards?
Most definitely.
No, good. I wouldn't want to miss that.
Yes.
Okay, so there are no risks on the 25th?
No risks whatsoever.
Right. As far as the risks to a donor, there's a height-weight chart that they have, and it's basically for the anesthetic complications. That you can't be too overweight. But other than that, than the anesthetic complications that are possible, there's really no risk to the donor. The donor actually has a harder time than the recipient.
Who should not or cannot donate or be tested?
Well, you have to be at least 18.
Okay.
And they just recently, a few years back, raised the upper age limit from 55 to 60.
So somewhere between the ages of 18 and 60. Okay.
Good general health, no major illnesses.
Okay.
You're looking at individuals that have not had any prior history of cancer.
Other than skin cancer.
Other than skin cancer. And everything else is pretty much what type of medicine they're taking. So every individual is different.
So that's a huge list you have to
Very
draw
large.
from. Do we have an established bone marrow fund, if you will, here in Truckee?
That's what Hugh's been working on.
So this drive is really the first of its sort to get that established.
Yes.
How long will somebody be on the list once they've been tested?
Until you're 60.
Until you become the age of 61, you're on your birthday of 61.
Okay.
So you
Or
do-
unless for some reason you become ineligible, before that time.
Okay.
Health-wise.
Health-wise.
Or if you just change your mind.
What are some other ways to help for people who may either be squeamish or cannot, for one reason or another, be tested on the 25th? Are there other ways that people can pitch in and help?
Definitely.
Most definitely, there are other ways. We do have a community outreach where we would like the community that can't get involved or are really squeamish about needles or have some medical history that they can't give, but they do want to give a little bit of something. They can help us by coming that day and helping us set up, and then setting up anything else in their area.
Okay.
And also financially, if there's any way that you can help financially, the National Bone Marrow Registry will match the funds that are raised in any group project. They'll match those funds. And they also will test you for free on an individual basis as they have funds available. My husband and I were both tested for free.
And now you have an interesting story, Gwen, how you got into this. If you could just give me a
I lived and worked in San
nutshell.
Francisco in the medical field for about 20 years, and the Chronicle was following a little girl named Nikita, who, and unfortunately, as has happened here, it takes the problem to have a name and a face before the community gets involved. And I think that we all should be involved long before the need. Anyway, I followed the story of Nikita, and she ultimately died because she was not able to get a marrow donor. I believe that you graduate from high school, you turn 18, you get your driver's license, you give a vial of blood, and you're in the registry. That's just the way it should be. If you're happy and healthy, and the things that we take for granted every day, that you can share that with someone and give them the gift of life. How can you possibly
Why
say
wouldn't you?
no?
Why wouldn't you?
Exactly.
Mario, what kind of response do you usually expect on a drive like this, and what can we expect to see on the 25th?
I think we're going to get an excellent response with the outreach that we've been doing here in the area. The newspapers have been very responsive with any of our stories. It becomes a much greater response when you have a child like this, where if you were to go into a town and not have anybody and just want to do a marrow drive, you wouldn't get such a high response. But with this, it hits close to home.
Yes.
It is someone that you really want to take care of,
Yes.
your community.
Yes, yeah, we can all associate with Jessie and
Yes.
wanting to help her out. And the good news on this is that we may not only be benefiting Jessie, but potentially anybody across the country or even internationally.
Yes.
Okay. We do have a film clip coming up, and that's from the National Bone Marrow Registry. We'll be watching that next. Mario, Gwen, thank you so much for joining us here on the show today. I
Thank you
appreciate
for
it,
the
and thank
opportunity.
you
Thank
for
you.
all the work you're doing on the Bone Marrow Drive. We really appreciate it.
Thank you very
Thank
much.
you.
Okay, we'll be back in just a minute.
Joan has a growing career in the world of finance. You wouldn't know it to look at her, but Joan has leukemia.
It's not something you can hide from, and it's not something that you can camouflage. It's a reality, and there's only one cure, and the cure is a bone marrow transplant, and they can only perform the transplant if they find a perfect match. I'm on a clock, and the clock is ticking. And if I don't find a match, I'll go into the next phase of my disease, and I'll basically die within 6 months.
Victor has his whole life ahead of him, but it could be cut short unless he receives a bone marrow transplant.
I'm a mother with a child who is dying from leukemia. I want, just like every other parent, to see my child grow up, go through elementary school, college, have a family, grandkids, and all of that. Without a marrow transplant, there is just no hope for that ever happening. And I would say to people out there, minorities in particular, that think of putting yourself in that position. How important would it be to you for someone to donate marrow to save your child's life?
Ethelyn is a wife and mother of 4, and she has leukemia.
I think of my husband. I wouldn't want him to be alone and not have somebody to share with.
I don't think about that. I'm too afraid to think about it. This is gonna kill her if we can't cure it.
I need a donor. We've been searching a long time. When you know that there is the source there that can help you, it keeps that hope alive in you, and then it helps you to keep fighting.
Hello, I'm Lou Gossett.
And I'm Sandy Duncan. These people have fatal blood diseases. Up until a few years ago, if all conventional treatments failed to cure them, they would have no chance to survive. But today, thanks to one of the most important medical breakthroughs of this generation, there's not only hope, but a possible cure. It's a bone marrow transplant.
No one understands the importance of this treatment better than Dr. Donald Thomas, the 1990 Nobel Prize winner in medicine for research in the field of marrow transplantation.
The bone marrow is a large organ in our body, and most people aren't really aware of it. It's about the size of the liver, but because it's scattered throughout the body, inside the bones, most of us don't know that we have it. It makes the red blood cells, the white blood cells, the other components of the blood, and if the bone marrow stops functioning because of disease, patients can't live very long. The reason we undertake bone marrow transplants is to cure the disease.
Before the transplant can take place, the patient must find someone whose marrow very closely matches his or her own. The first place to look is to a brother or sister, but 70% of the time, a match is not found in a family member, so the search begins for an unrelated donor.
I want you to meet a boy whose family searched for an unrelated marrow donor. His name is Drew, and when he was about 2, his parents were told he had aplastic anemia.
When Drew was diagnosed, everything stopped for us. Everything else that in your life you thought was important stops. It stops becoming important.
You just can't believe that it's happening, and you just keep saying to yourself that this can't possibly be true.
Immediately, a desperate search began to find a donor who would save Drew's life. Today, Drew is alive because they found a donor. His name was Jeff.
Until actually it happens to you, you can't imagine how good you could feel about saving somebody's life, especially a child. It was his last chance of survival. It really started sinking in what I did. I gave a person another chance to live.
Without the transplant, Drew would have died. And just as sure as Jeff had pulled him out of a burning building, that marrow saved Drew's life.
Your arms too. With your arms too, come on.
To help find that life-saving marrow match in Jeff, Drew's parents turned to the National Marrow Donor Program, or NMDP, a congressionally authorized network that recruits and helps match volunteer donors with those who need marrow transplants.
Through NMDP, community-based donor centers, potential donors give a small blood sample to test for characteristics that are used in matching their marrow to the patient's.
The procedure to become a donor is really very simple. Initially, after the decision to become part of the registry is made, a small amount of blood is taken, several tablespoons. That blood is used to establish the tissue type of that donor. That tissue type is then becomes part of our computerized list, and when a patient in need of a bone marrow transplant searches the list, if that donor is then identified as a potential match, the donor is called back to the local donor center. A small amount of blood is again taken for further testing. If they then turn out after the second round of testing to still be the best possible donor for a given patient, we'll have a session with their local donor center where an individual who is well experienced and knowledgeable about bone marrow transplantation will sit down with them, tell them all the details of donating and actually the process itself. And if after hearing that description they feel that they want to proceed, then a physical examination is done, further blood testing is done, and they are then identified as the donor. The marrow collection is done in a hospital under anesthesia. The marrow is taken from the back of the pelvis through a special needle and syringe. No stitches are necessary, but the donor probably will experience a little soreness at the collection site when he or she comes out of the anesthesia. The donor probably will require blood during or after the procedure, and he or she would have donated his or her own blood before the collection for this purpose. Typically, the donor stays overnight in the hospital and is back to pre-donation activity within 2 or 3 days. The marrow will then be hand-carried to the hospital where the transplant will take place.
Now, here's a challenge. With the current size of the registry, we are only able to find a donor match for less than 30% of those who need one. That's why we need to register and test many more people who are willing to become marrow donors.
There is an especially critical need to register people of different racial and ethnic backgrounds because donors are identified through genetic traits. Matches usually occur between people of the same race. For example, if I, as an African American, were in need of a marrow donor, my chances of finding that match would be greater within my own ethnic group. The same is true of people of other races, such as Asian Pacific Islanders, Native Americans, or Hispanics, like Danielle.
Danielle has aplastic anemia, and that's a life-threatening illness.
How many blues?
One.
One?
It's important that we find a match for Danielle.
My turn?
It's a matter of life and death. I don't want my little girl to die. We need a lot more donors. We need people to be aware of how important it is and how easy it can be. Her only hope is a bone marrow transplant. And that'll be her chance for a new life.
Not only is this important for those who need a transplant right now, but it's important for all of us. The day may come when you or someone you love is diagnosed with one of these potentially fatal diseases and needs a marrow transplant. I'm sure you would want the best chance possible of finding a match. That can only happen if we test thousands of people. If you are between the ages of 18 and 55 and in good health, here is your chance to truly make a difference in this world. It is a matter of life and death.
For more information on how you can be a part of this life-saving treatment, call the National Marrow Donor Program or your local donor center today. As we put up the phone number, listen to some comments from some marrow donors who have experienced the feeling of saving someone's life.
Donating bone marrow, for me, I look at it as being one of the luckiest opportunities I've ever had.
When you think that you've actually been picked and that you actually have a chance to save this person's life, it's overwhelming.
It is a very rewarding and exciting decision to make.
To give so little of yourself to help someone else is such a great feeling. And I couldn't express it more by saying that if I had the opportunity to do it again, I would.
If I matched in half a heartbeat, I would go and do it again.
It was a neat thing to do. I've never regretted it, and I never will.
You have a chance to give someone the greatest gift of all, the gift of life.
Jessie Williams is a special friend and a special asset to our community. By joining the bone... I'm silly? I think you're silly. But I think if people show up, on July 25th, they'll have a chance to help you out. And if not help Jessie out, help out somebody across the nation or even internationally. Please be there on July 25th, and you'll have a chance to help this very silly young lady. Thank you for joining the show. Hugh, thank you. Thank you, silly. Say goodbye. Hi, I'm Maya Schneider from Truckee Talks with a reminder that the bone marrow drive for Jessie Williams is scheduled. We look forward to seeing you there on July 25th.